wanted to give an update on the new coronavirus that we're calling COVID-19 that started in China at the latter part of 2019. Now, the first case that we had in the United States was on January 21st, and then it was reported to be community spread as of February 29th. And community spread sounds scary because we're not used to using certain terms like that, but that is how the flu spreads every season, how other viruses, how the cold virus spreads. And community spread means that we don't know exactly who we came in contact, what surface we touched, just how exactly we ended up sick. And so that is now in some communities how COVID-19 is spreading. So as of last night, and this is a moving target. It's evolving every day, sometimes every hour. But as last night, there were over 800 cases in the United States and approximately 25 deaths, primarily in Washington, California, and New York. There is now one COVID-19 case in Kansas in Johnson County, and a resident under 50 who had recently traveled to the northeast part of our country. So there are no confirmed cases, COVID-19 cases in Sedgwick County at this time. So we are at low risk at this time because we don't have any identified cases. Now, in order to provide the most accurate information to the community, I and anyone else talking on my behalf will be reporting on positive cases and not who might be under investigation or quarantine, because it's been very confusing whether there is misinformation communicated at times or just misunderstanding. There's a difference between cases, people being tested, and people that are positive. And so to minimize that confusion will be just reporting cases that are positive, because those are the ones that are going to have an impact on our community. So at some point, a Sedgwick County resident is going to test positive for COVID-19, likely due to travel exposure. If the virus begins to spread in Sedgwick County, reports from other countries are that most people who get the virus show mild to no symptoms, and they'll not need to be hospitalized, and that's over 80% from what we've seen over the world and the country. Now, as Tom mentioned, the most vulnerable population are those 60 and 65 and older that have pre-existing conditions such as heart disease, lung disease, diabetes, have compromised immune systems because of going through cancer treatment. We are in the process of working with our long-term care facilities to review their infection control protocols. There's a very small amount, actually, of our older population that actually live in long-term facilities. So we're going to be reaching out and partnering with our pharmacies in attempts to reach that population more and provide information and preventative measures to them. Now, anyone going to a pharmacy can benefit from that, but we're really trying to reach that vulnerable population who are also often outside of H1N1 in 2009 are the most vulnerable for the flu, which we also still have in our community. So COVID-19 is spread through someone that is infected with COVID-19 sneezing or coughing into the air instead of using a tissue, and then touching a surface so that it can be transmitted to us when we touch a surface that's contaminated with germs. Now, the symptoms include a fever over 100.4 and a cough, and then difficulty breathing, and some people are reported to develop pneumonia. There's not any treatment for COVID-19, so if someone is in the hospital or at home, then what they're doing is treating their symptoms to reduce the discomfort of feeling ill. So what can we do to protect ourselves from COVID-19? Well, the Center for Disease Control is recommending no non-essential travel to Iran, China, Italy, and South Korea, and then taking everyday action that we, sometimes I think oftentimes cut corners on and get busy, and that's washing our hands and washing them thoroughly versus, and I've been guilty of washing them quickly and leaving, but you really, especially during flu season and now that COVID-19 is in our country and at some point coming to Sedgwick County, is taking the time to thoroughly wash the hands between the fingers, underneath the fingernails, and you'd be surprised how long 15, 20 seconds seems. I mean, it's just a drop, but it's really recommended that we all wash our hands for 15 to 20 seconds. One way to keep track of that is singing happy birthday twice, and even if you do it quickly, you're still washing your hands more thoroughly than often many of us do. And one of the other important things is keeping our fingers away from our mouth, nose, and eyes. If we have a virus on our hands, we don't become ill through it absorbing through our skin. And that was one myth that I've heard, that if you touch something, you're automatically going to become ill. And that is not the case. We have to then touch our eye, our nose, or our mouth. And it is a habit, and a hard habit for a lot of people to break. So whether you sit on your hands in your pocket, playing with a rubber band, or whatever, I really would challenge everyone to just be aware of how often we do that. I'm kind of hyper aware at this point and have to watch myself from putting my finger in my eye. But it happens everywhere. And so that is how viruses and the flu are spread, and how COVID-19 is spread, as well as not sharing utensils or cups, and avoiding sick people as much as you can. Close contact with COVID-19 is considered to be within 6 feet for more than 10 minutes. And also staying home if you're ill. That's a really important one. Oftentimes people tend to come to work if they're sick, and it's important to stay home. So as of yesterday, what's going on in our community is not just the state health department is able to test now for COVID-19. We have commercial labs in Sedgwick County and Wichita that have been approved for testing, and so they are able and ready when someone fits the criteria of either a travel history, coming in contact with someone that has COVID-19 and having symptoms. Now, when and if we get to the place where it's community spread, that criteria is likely to expand and to change. And as Tom mentioned, we're meeting with our partners at our Emergency Operations Center. The meeting that we had, the first meeting we had last week, we had over 50 partners that came to discuss infection control and to make sure that everybody was on the same page and had accurate information. A lot of good questions were asked and answered, and we're going to continue to meet weekly and do everything that the community can to reduce and fight the spread of this disease. So CDC, we have the advantage to being in the middle of the country. Dr. Mins made the comment that people say we're flat, and then obviously said boring or not, but there's an advantage to being in the middle of the country because we're not one of the first that have been affected by COVID-19. So the Center for Disease Control, they've been able to learn a lot in a very short period of time from what's occurring in other countries and what's occurring in other states, and they are continuing to learn from that and modifying guidance. And then sending it to our state health departments, who then send it to us. And we are in constant contact with our state health department as well as Center for Disease Control. So I'd like to end by stressing that, it's new and it's frightening. It has a lot of anxiety up in our community and all over the country. Part of that anxiety is feeling like it's brand new and we don't know what to do. We do have a lot of control over the spread of illness, and just watch people. Just start watching our habits and how often we sneeze on our hand and then we'll touch something and then we don't wash our hands. So washing with soap and water is very important. And if soap and water is not available, to use an alcohol-based hand sanitizer to wash our hands. So that's what is really important to remember, because we can make a difference. And it's important even for young and healthy people to wash their hands thoroughly, because then we can help protect our most vulnerable population. Be happy to answer any questions.
Okay, thank you, Adrienne. We do have a question or two. Commissioner Cruz. Thank you, Chairman. How long, is there any data that says how long the virus will last on a surface? Is there any data?
It's not totally conclusive. There's data coming out, but it's not conclusive from several hours to several days. But so what we do know now is that it does last on surfaces very similar to other viruses in the flu can. But the whole duration of it, no, but it can be killed with Clorox-based wipes. So wash surfaces as well.
Okay. I appreciate you being here today. I think that there's a lot of people who are kind of freaking out about this.
Absolutely.
And, I think if we take a more sort of calm approach about things, we might be able to really protect ourselves in a way that we've always been able to. So I just appreciate your constant updates. Any questions that we have, you've always answered those. So I appreciate you being here today.
Thank you.
Thank you, Commissioner Cruz. Commissioner Dennis.
Thank you, Mr. Chairman. Actually, I was going to bring this up during other today, but since we're talking about this subject right now, I thought it'd be a good time to talk about it. Last night, I was able to sit in on the selection board for the Cadet Corps Command group for next year, and we interviewed 6 kids that were going for Corps Commander, Deputy Corps Commander, and Command Sergeant Major. And one of the questions I asked dealt with current events. I asked what we as the Board of Health could do to help get the word out and help protect our community. And it was kind of interesting. These are very intelligent, top of the class students. But
How old are they?
These are all going to be seniors next year
in high school.
Okay. But one of the things that I don't know if it's a good idea or a bad idea, but they said check your imports that you're bringing in from other countries to see if they're bringing anything in. They recommended maybe car dealers disinfect the cars that they're shipping in from other countries. So I don't know if that's an idea or not. I don't know how long it persists when it gets on an object, but that was one of the suggestions. Another suggestion was they don't feel that the information is getting to the schools well enough so that they know how that students know what they need to do to protect themselves. So that was a recommendation. They had the common recommendation of wash your hands, and they just wanted more information out in the community. So I appreciated their answers very much. I just checked my email a couple minutes ago. They're supposed to announce who the Corps Commander, the Deputy Corps Commander, and the Command Sergeant Major is today, but I haven't gotten an email yet. But I know that this is off subject just a little bit, but I wanted to let you know that from South High School, Alexandra LaForge interviewed. From North High School, Victoria Brown. From East High School, Arian Akins. From Northwest, Jonathan Turner. From Northeast, Peter Porcaro. And from Southeast, Mia Della Torre. So it was a fantastic evening last night, but they have some very good ideas. We need to listen to our students. Thank you.
And we are working with USD 259, and they also are one of the partners that we are meeting with weekly at the EOC.
Okay. Thank you, Commissioner Dennis. Commissioner O'Donnell.
Thank you, Mr. Chairman. Adrian, thank you very much for the update today. I'm most thankful that you've been on call now for the last couple of weeks on this issue as we're anticipating, not hoping one comes to Sedgwick County, but anticipating that will come soon. And that's why, as the manager mentioned earlier, looking at doing some maybe telephone town hall type meetings, just engagement for the public to call in, get more information. I know you'll probably be on a panel on Monday on KWCH, so we're doing what we can as the Board of Health to get this out. I do get questions, and I got a question from a constituent that lives in Clearwater, and he wanted to know if it's transmittable via mosquitoes.
There's no evidence that can occur.
Okay, all right, well, great.
Other things, but not COVID-19.
Okay, other things are, but not the coronavirus. Okay, that's what he was. He had sent me a text message about that just a little while ago. So
there are all sorts of questions, and we welcome those to be able to respond and demystify if they're not accurate, respond if they're accurate, and demystify. We are working with 211, United Way 211, our partners who we often work with in times like this where we have for measles outbreaks and H1N1, and they are a great resource if anyone in our community has a question, and even like that, if United Way comes upon a question that they don't know the answer to, they call us and then they have the answer and add that to their long list of questions that they are getting from the community.
Thank you very much. Thank you, Mr. Chair.
You bet. Thank you, Commissioner. Commissioner Howell.
Thank you, Mr. Chairman. I am I don't know a lot about viruses, but if this is similar to other viruses, I think I know a little bit about it, but I'd like to have you confirm some of the thoughts here, if it's okay. I've had some questions about if someone does actually become sick with the coronavirus after they've recovered, are they still susceptible to future, in other words, do they have the antibodies, if you will, in their system at that point to be, if you will, not susceptible to it in the future?
That is one of the things that is not totally known at this time. When someone does have COVID-19 and is in isolation, before they are given the green light to go back out into the community, they have to be symptom-free and have 2 consecutive tests that are negative. Now, whether or not they can get ill again, we're not sure.
Okay. The other question that I've heard is if someone is exposed to the virus, does it necessarily mean that they will get sick? Is there any there are people who are exposed to the flu virus, for example, and if they have maybe a weakened immune system, maybe they're more susceptible of getting the flu. Possibly they have antibodies, or maybe they're just not susceptible for whatever reason. They may not get sick. So, is this similar to that, or if they are in the environment of the virus, is it likely that they'll get sick, or is there some people who don't get sick even though they may be exposed to the virus?
Not everyone will necessarily get sick that are exposed, and again, the symptoms can be very mild to more severe and even death. The research is showing that children are likely carriers, but they don't seem, they're asymptomatic as far as not having symptoms. And if someone is a carrier, it means that they can spread the virus. And at this time, they're still not sure how long, if someone spreads once they become symptomatic, or if they can spread a couple days before, a couple days after. So we're learning more as more time goes on.
Yeah, that was probably my third question, is if it's possible for someone to have the virus and not know it, and possibly be spreading the virus because they're not aware that they have it. And that probably is very, very challenging in this case.
I believe that is true because the mild symptoms can be similar to a cold, and we don't usually go to the doctor if we just have a cold. And so once it is community spread, then it's more likely that since we have other viruses and we still have flu in our community. So I will say that even though March seems to be a very bizarre time to get a flu shot, we still have, we seem to be on the downhill, the downtrend for flu in our community, but we still have the flu, and we still have flu shots available because there are a lot of people that don't get the flu shot that can still get the flu. But yes.
I guess my last comment would be this, if you'd like to comment on it, but the masks we see people wear constantly, I've heard in the news, and you can please confirm, but those masks are really for someone who may be contagious, protecting others from spreading that disease. They would not spread it to other people. But in terms of them not getting the disease, it's not really effective for that. Can you please comment on that?
Thank you for asking that. That is true. There's a lot of mixed messages, particularly when we see people in other countries that are walking around with masks on. But the type of surgical mask that you're referring to is for people that are ill. So if someone, once it is in our community and community spread, someone that is ill, if they come in, walk into an agency, may be asked to put one of those masks on. So you're correct. They are for people that are ill. There's no evidence-based or science behind showing that they are effective in keeping someone from becoming ill.
That's very good information. Of course, the better option, if you're sick, is to stay home.
Absolutely.
Thank you. I appreciate your comments this morning very much.
Thank you.
Yeah. Thank you, Adrian. And I'll just, one quick brief comment is that this news is changing daily, seems like. There's updates.
Yes.
You've referenced it's national. There's national press conferences, so you coming back every week might be a good part of our agenda just to we don't have to go into as much detail as today, but just as anything new would be helpful.
I'll be here.
I was at Textron yesterday and for an event or a great cause with Textron with development of some employee workforce, and the governor was there, and I was comforted by hearing her say that Topeka and the governor, their office, KDHE, is in constant contact with CDC and other national medical people, and they are in contact with you. So I really feel that at least there's some great communication going on nationwide, and the governor was really, I felt comforted that I was glad she's in the loop and that we're in the loop with you. So if that helps, I think we should be keeping the information as fast as we get it. So
Absolutely. That's the plan.
thank you.
Thank you.